The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm your host, Rebecca Miller, along with our co-host, Otto Lohse. Good morning, Otto.
Good morning. It's supposed to be 60 degrees today.
I heard 70.
Really?
Beautiful out. It's so nice. So thanks.
We should do the show outside.
That's our report for the show. Also, our wonderful radio show producer, Christina Liu, and we'll be hearing from Christina again later in about an hour when we're in the Talk of the Town segment. Our guest today is Reema Nirola, and Reema is the owner of Seniors Helping Seniors, and it's in Eastern Nassau County. It's an in-home care service. So we'll be interested to find out all about her company and the services that they offer and how people get those services. So I see that she's arrived. So welcome, Nirola. How are you? I'm Rebecca, and our co-host is Otto, and of course, you know Christina. So how are you today?
I'm fine, thank you. Good morning, everyone.
Good morning.
Yeah.
Good morning.
Yes, it's a wonderful day today. Now the weather is changing. It's good things are happening.
Yeah, we were just saying the same exact thing. You know, It feels good. The weather's nice. So thank you so much for joining us. And, we just wanted to hear a little bit about you and your company.
Yes, that's very good. First of all, thank you so much for giving me opportunity. So we are Seniors Helping Seniors. It's a franchise, and I'm taking care of organization in Long Island, Eastern Nassau. So I take care of all Eastern Nassau territory, from all the way from West Hampstead to all the way to Carmack. And we're helping our seniors to live in their own home or in the facilities with dignity and respect. We help them with the non-medical services such as companion care, take them to doctor's appointment, shopping for them, meal preparation, light housemaker, overnight care. Is a wide variety of services provided by the compassionate, loving, caring providers who really want to do good, and at the same time they want to make a living.
Is Seniors Helping Seniors, is that like a national franchise or local? How many locations do they have?
We have almost over a 200 plus locations nationwide, and as well as international as well. So we have in Canada, we have in London, we have in Milan. So it's all independent owner who take care of in their own area.
And you indicated yours is Eastern Nassau? Yes,
Eastern Nassau. Yes.
So would you cover Westbury or places that are in North Hempstead?
Yes, sure. We do Westbury, North Hempstead.
Oh, you do? Okay.
Yes, we do. And we have other franchise partners as well who cover the other area.
I'm going to ask you a question that has nothing to do with this, all right? You're from India originally, and I read that it said that you came from a very large household.
That is correct, yes.
What does that mean? How large is large?
We used to have our grandparents, aunt and uncle, everybody used to live together and learn a lot,
Yeah, a lot of people?
A lot of people, yes.
Yeah, that's good. Yeah. As long as everybody gets along, right?
That's right, absolutely, yes.
One of the questions I have, the name says Seniors Helping Seniors. What does that mean? It means that seniors are the ones who do the helping only?
Yes, it's the active seniors, like a young seniors, and who's helping less active seniors, like anyone, I will say, 60 plus, 50 plus. Age is just a number, as you say. So they're helping the less active seniors. It's all actually depends on individual. Like some people, like they're pretty active even in the 70s, 80s, 90s, and some they need a help, So we actually sort of like a match and see who will be a compatible person to work with that person. So that they will help with daily active living things, like maybe they need help, maybe to make like a meal preparation, like a simple chore. Sometimes it's very hard to do at home, for some people. So that's what we actually do the intake and see how we can make a difference in their life. So we match with the compassion, loving, caring person to do with all those services for them. So maybe meal preparation, maybe cooking, maybe do the laundry for them, maybe just light housekeeping for them, or some like they have symptoms of dementia, so they need somebody to give a company or socialization for them. So that's what we actually do.
And the last 2 years for everybody obviously has been quite different. And I would think for you it was quite different in that people couldn't really go to anybody's house. How did you go about adjusting to that?
That's a very good. I'm sure. Like we feel proud. Like we went through. We are survivor. It was a very very tough time for everyone, including us as well. And since our nature of business to have like a more people to people, but with this COVID and everybody is so isolated, so we're trying to we protect ourselves and protect our caregiver as well as the receivers. So what basically we do for them, if somebody need any help with the grocery shopping, we did that. And we will keep on checking with everyone who's taking the services from us. We stay on top of that through the phone calls or with the social distancing, guess we used to meet with them to make sure their needs met. And what we used to do, like if there's somebody need any help with the grocery shopping, so we used to keep them in their push. Like first few weeks was very, very tough because everybody was so afraid and fearful. And then we tried to keep them socialized through the Zoom as well. So we used to have some like games for them, videos for them and all that. I'm sorry about my phone call. It's ringing right now.
Maybe they want to know about your car warranty.
Yes.
Yes, absolutely. That's another thing, like most of the calls right now is like mostly it's a scammer looking for your information. And we actually educate our seniors as well because there's so many calls, scammers, so just be careful with them.
And we'll get back to you as soon as possible.
So Reema, as you know, Project Independence is an aging in place program. So a lot of the services that you provide are also things that Project Independence does and connects people to. But one of the things I'm interested to know is, are people on schedules? How do they connect with you? How do they arrange for these services? And how does that work? So if somebody is listening, wants to utilize the service, maybe one time, or maybe they're going to need services, going forward. How does that work?
That's a good question. Yes, people do connect us, like there's a word of mouth as well. And we have all like a different advertisements goes into different various resources like a print ad or speaking engagement or digital advertisements. There's so wide variety of services we offer. They come to know from different, like they call us or maybe they meet with us and they check like we come to know like what exactly they need help with. And sometimes we help them with the care plan and all that. So then we will see who will be the right match to work with that person. And then we match that person with that and they start the schedule. And then we get the feedback, like how they like that. Some people, they start with a small number of hours and later on they build up with the more larger hours. And sometimes they start with the more hours and once the things get better and they reduce the hours as well. So we work, we're very flexible with that. We work, it's not on any, like a number for us. We really have a mission to help our seniors to remain independent.
Right. I'm not sure if I missed. Go ahead.
No, I'm sorry. I'm not in this business, although I'm on the edges of it. Okay. Uh, it would strike me that somebody in your situation would have a lot more people who want help than you have people who will give the help.
Right.
Like, how difficult is it to get the seniors who are going to help the seniors? How do it seems that a lot of those jobs to me, they may look easy, but they're not. To be a caregiver is not an easy thing. And
Right.
how do you go about getting seniors who are going to be the helpers, if you will?
Right. The provider who wants to help, like we actually check. We have like a sort of like a screening process. Like we ask the questions when they come and meet with us. We try to find out what is their driving force, what they want to give back to the community, how they can be helpful to our organization and help to the seniors. So we try to match. Like for example, let's say someone comes and say, "Oh, I can help with doing the meal preparation, and I can help doing with light housekeeping, or maybe I can help to take them to doctor's appointments, and with that, with the social interactions as well. Like when they are there, we don't want to have them to become a vegetable. We just want to involve them to make it better. And we actually check with the receivers as well. Like, okay, if you want to have someone to come to you and help you, what kind of person you need? So we match it with that, and they become like a more friends and long term as well.
Now, the step before that, though, like this is now you have somebody to talk to. To
Right.
me, the hard part would be getting people to talk to.
Right.
How do you reach out and get these seniors to the point where you can even talk to them? You can't walk up and down the street or,
Right.
to me, I mean, I'm looking from the outside in. It strikes me that would be very difficult.
Okay. And normally we do, we ask them, we have like a sort of like a questionnaire, and we gather that information to see what exactly they need a help with. And so we try to match it with the request and see what we have and match it with that person who's going to offer that services.
Okay. So, but if somebody wants to be a helper, right? How do how do they go about being that, and how do you find the people who want to be helpers?
Okay. So normally they come from either word of mouth, or they come from different advertisements. So we screen them. First, we screen them over the phone and see what exactly this is something he really or she really wants to do. And then we will match it like how many hours and how many days you're looking to do, and what is their motivation and driving force. So some pretty much have like a different, okay, I want to do it to learn about like I'm retired or semi-retired. I want to do this services. I want to give a try. So then they do and see, something really works with that person. So based upon that, we have them on board, or to do all those daily active living things.
Right, and they get paid a small amount to do this.
Yes.
Like, can you tell us roughly what?
Yes. Yes, it's a range from like a 26 to 30 an hour, depending like a number of hours. The more hours you take is more economical, and the less hour is more like a higher side. And the same thing with the provider who work for us as well is the same thing. How far they want to travel, how far they want to go and work, and what they want to provide, what kind of services they want to provide. So based upon that, they do the evaluation.
Right.
So one of the things I'm reading up is that you're also providing respite care. So does that usually happen when you're doing in-home services like medication management, and then you maybe notice that the caregiver may need a break, or is someone coming to you saying, hey, I really could use respite? How does that usually work?
Yeah, that's what when we do like an intake or initially we spoke to them and we come to know their situation, like what kind of care they need, who need a break, So based upon that, like we do the evaluation on that. Yeah, sometimes it's very important, like, and especially like if someone is a caregiver, maybe they're taking care of their yeah, their mom or mother-in-law or somebody, aunt or uncle, maybe they have like a dementia, because dementia, when you see anyone going through some health issue, you actually check them, like, okay, you see any physical change. But with the mental health, is really a lot. You can't even tell, what is the problem. So sometimes you need a little break, to themselves, so then we actually help, like how maybe they want to go away, or they just want to go for a walk, or maybe they want to go
Right.
shopping, so at least they don't have to worry about their loved ones, because at least somebody is at home to taking care of that, and this way they can take a break.
And so can you tell us a little bit about the long distance check-ins? Listed?
Yeah, sure. Like sometimes is nowadays is a very nuclear families. Families are far away, maybe because of the job reason or maybe some other reason. Let's say we have someone in California, maybe we have someone in Florida, or maybe some other part of the US, so, or even international as well. So basically they ask, to provide, if you can have a check on it. So we provide that kind of services as well, so we give them a feedback. We have them to do like a FaceTime calls as well, and Zoom calls as well. So we do, and we check like what exactly they need. They want to see, or they want to talk, they want to go over all the medical appointments and all that. So we just make all that service plan for them.
Do you ever get involved with anything like Alexa when you're doing that?
I haven't done it by myself yet. Yeah, but some of the other franchise partners, they have used that model.
Right.
So a lot of things that we talk about on with a lot of our guests, and Otto is kind of talking about it a little bit, is, during the pandemic, of course, we all kind of, it was terrible, and services had to be provided in different ways. And actually, we're going to take a break before I get into the next question. You're listening to Project Independence and You on Community Talk Radio. We will be right back after a quick break.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Okay, welcome back to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm your host today, Rebecca Miller, along with co-host Otto Lohse, and of course, our wonderful radio show producer, Christina Liu. Our guest today is Reema Nirola, and Reema is the owner of Seniors Helping Seniors. So we're getting a lot of information on the services that her company provides and how to access it. And just before the break, I was just talking about, which we do talk a lot about with most of our guests, is not just the experience of going through COVID, but the things that we learned during COVID, and that we're going to continue to kind of use. Like you had mentioned Zoom, once COVID happened and we became, everybody was working remotely, we were able to do a lot of programming on Zoom, and we're still doing that now. We have a lot of in-person programs coming back. Some are hybrid, like we just had our first advisory meeting, and that was very successful on Wednesday. Otto was there. We had people come in person, and we also had a big screen with people on Zoom who still weren't ready to come. So, that's one of the things that we kind of learned and will continue doing into the future. There's a lot of other things. So I'm just wondering if you had found things that you had a change to do during COVID and are going to continue with it to some degree.
I'm sorry. I couldn't get you. Your voice is breaking up.
Okay, can you hear us now?
Yes, I can hear you now. Yes.
So I was just curious if anything that you learned something over COVID that you're going to continue doing down the road.
Right. Yes. Yes, because at the time of COVID, as we all know, like we are survivors, and it's actually taught us what I have noticed, like earlier before COVID, everybody was so busy, even the families were so busy of individuals. But I think with the COVID, if I see the positive side of it, it's bring all the family close, and they start taking care of their elderly, or they're taking care of their loved ones. So that's a positive thing. I know we have lost a lot of friends and relatives in this, but at least what we have, we actually give us a little more value or more respect. Yes, whatever we have to take care of it.
I noticed, in reading to get ready for the show, there's a lot of things you do. And one of them was, it says outing trips, that
right.
Somebody was caught. Now, I'm going to ask you a question. I have a friend of mine, as an example, who's my age, who loves to go to the racetrack, but he cannot go to the racetrack anymore.
Right.
Would that fall under outing trips?
Yeah, that's a very good question. This is even I can share a story as well on that. And we have helped a lot of seniors as well. I share like one example. We have like one gentleman who really liked to go out and eat, but he couldn't able to drive because he used to drive, but the family doesn't want him to drive. And he was actually end up in one of the facility in assisted living. So, and I used to see that person because I used to go so many times to see other seniors in that facility. So I see he always complained about something, and he was very become a very sort of agitated and upset and all that. So one day I went to him and asked, what is the reason why you are so upset? Why you're not happy here? Why you are keep changing from one place to another place, one facility to another facility? And how we can help you? So when I introduce myself, learn more about him as well. So his phrase, he was thinking assisted living is a parking garage for elderly. That's what he told me. So it's really, make me think about it, like why he thinks that way, how we can make him like to feel a little better. I said, what is there you don't like about this facility? And he said, oh, I don't like the food. I would like to go out and eat food. So I said, okay, can you afford to eat outside? We can make you a care plan. Maybe you can go with one of our provider. Yes, there's a fee for that service, but you can go to your favorite restaurant and you can eat. Maybe that will make you a little better. So he actually took the services and he started going, to all like different places to eat. So he was feeling a very different person. At least he get like a one activity or two activities in a week to go out with a provider and eat out of his choice, and just see other people and socialize. So it makes a difference. So he lived a little bit more years, with that. Otherwise, he's gonna feel depressed and lonely.
This is all such great information, Reema. If somebody wanted to get in touch with you, how would they get in touch with your agency? Do you have a phone number or website? What's the best way for people to reach you?
They can call. The phone number is a 516-390-8938. They can reach us through the website as well as a seniors.com/Eastern NASA. And they can also reach us by the email as well, So all the information on the website as well, and the email address, I can give you that as well. It's a shsplainview@optonline.net. So just a phone call away. There's answering services, so they can give us a call back, and we can help them to make a care plan. So whether they take the services for 1 day in a week, 5 days, 7 days, 3 days, 2 days, everybody is individual, and morning, afternoon, yes, we can help them out.
Before we go to break, I just have a question. One more question. I don't know if you covered it or not. Are any of these services covered by insurance?
Yes, there's a long-term insurance, so they cover part of this insurance in services, and private pay.
Okay, so you can go through long-term insurance. If anybody, listening and you're interested in this company, you can also give 311 a call, 869-6311, and we will certainly get you the information. I really want to thank you so much for joining us today, and you have an excellent company, and I'm sure we'll be speaking with you more down the road. You're listening to Project Independence in You on Community Talk Radio, 88.1 FM and WCWP.org. We will be right back.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. Those little button things on your phone screen. Just ask your grandkids.
Oh, welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. Your host, Rebecca Miller, along with co-host Otto Lohse. And now we are in our Talk of the Town segment with Christina Liu, who is the radio show producer and brings the show together every week. Another really interesting guest. It's good to know that there's so many options. I mean, there are options out there, for seniors. And if you're lucky enough to have long-term insurance, these are some great services too. So that was another really great guest, Christina. Thank you so much. And who's on for next week? Because
next week you won't be here. You have some nerve, and you are going to miss a fabulous show because we have on Dr. Seymour Huberfield, who is going to discuss the importance of sleep. So you're missing a good one, Beck. You might have to zoom in from where you are.
Well, you know what? Maybe I can.
That'd be fabulous.
Stepmom.
Oh, and your stepmom could come on too. Listen, I'm thinking, Beck, you need to make this happen because it's an important topic. I think we are always talking about sleep and sleep patterns and, people's difficulties with it. And I think it's an important subject for all ages. So I'm really, really looking forward to that interview.
Yeah, it's going to be interesting. So he's a pulmonologist and
he's a pulmonologist and a critical care medicine specialist, and he does sleep medicine over at Northwell. So
critical care medication, which
critical care medicine specialist,
doctor. Right. He's critical care doc. Mm-hmm.
So that can include things like pain management.
Yeah, I'm sure it does. Yeah, perhaps. It could.
Well, that's critical care.
Yeah.
So that'll be a really good show. So I kind of talked a little bit about our advisory that we had Wednesday. That was our first in-person advisory. We had it right here at CGM where the Project Independence office is. And we had a nice turnout. The town supervisor came, council people came, and, a lot of the seniors came, which was nice. And we also were able to do a hybrid. I think, was that our first go of that, Christina?
Yeah, so that hybrid. Was we've done, hybrids on smaller scales with, the support groups and stuff. There's been a little bit. This was the first meet. And it was very interesting because, we were all curious to see, how many people were still going to be Zooming and how many people were going to be in person. And, we had about like 60, 65 people, in total. And there was like a good amount of people still Zooming. So I think it's an important option, to have, both kind of things available. Obviously in person is wonderful. And it was nice to see a lot of faces that we haven't seen in 2 years. So that was great. But there was people who were able to Zoom in too. And I was saying it's not even necessarily just a COVID thing anymore. Having the Zoom feature is just really convenient and helpful for a lot of people who can't necessarily get out or have, multiple things going on, so to have that kind of as an option, I think really opens it up to, a whole audience. So it was a great.
And like you said, they can Zoom in from anywhere. So if they're visiting family, if you're not going to miss a beat, or if you don't drive or whatever, you can now take part in, and again, not just the advisory, but all of, any of the programming that we have pretty much. So Otto, as a Project Independence member from almost day one, how did you feel about the advisory as a hybrid?
I thought it went well. I don't know what it was like on the other end, on the Zoom side. It can't be the same, I don't think, because you can't see when other people were talking who were sitting out in the audience. You hear them, but you don't see them. So you're kind of locked in to the screen we see now, as opposed to if there were a camera that also shot out on the audience, it might make the Zoom experience a little bit more like you're in on it. But now you're getting into technology areas that maybe you need to have a full-time production person. I thought one of the things that I thought was good, we all love Judy Bosworth, and she was super supportive of Project Independence. And I think for some people, the fact that Supervisor Jennifer DeSena was there and showed every indication of being a positive supporter of Project Independence, I think is a good thing, because anybody who had any apprehensions about things being changed or whatever, I think that has passed. I think that, this is go forward with Project Independence like it's been doing all along. And I think that kind of feeling was what I got, part of it.
I liked what she said too about Project Independence. What was the term she used?
She called us the gem, I believe, of North Hempstead, which is going to have to be put on T-shirts now. So, I loved Jennifer DeSena before, and this really just sealed the deal for me. But it was just, it was great, and it was nice for her to get to meet our, members in person, because when she first started, things were still all kind of virtual. So it's great for her to be able to get out there, and Councilman Walsh was there too. So it was really nice to kind of just get them acclimated, and they got to meet our staff and our social worker and nurse, two representatives from, our grouping did presentations, and, they're offering such wonderful services to, all of our seniors, and it was just it was really nice. It was just like a very lovely day. The sun was shining outside. We had it was great. If we were production and did this whole thing, it would have been fabulous. So
you had a great food spread there. It said that was far from you ran out.
You didn't run out.
No
there were more carbs there than I even could. It was like
balanced out. The yogurt. There was yogurt and fruit, so there was a good mix of things.
I think the flyer said light snacks.
It was light refreshments.
You could have breakfast, lunch, and dinner on that.
It was quite the spread. Community service does a great spread. And then the next meeting will be on April 13th at Fushillo Park. Will be the next location. That's over in Carl Place. So it's nice. We're going to be kind of moving around throughout the town, taking the show on the road to different locations. So if anyone is interested in participating, you can call 311 or 516-869-6311 to join.
How many people were in the room in person?
In person was about 40, I think like between 40 and 45. was in the
Okay.
room. And then there was like another 20 something on the screen. So I was counting, feverishly to see what was going on. But yeah, it was great. And also exciting is that our Pioneer newsletter has hit your homes. Hopefully everyone is receiving it. And I know it's been hitting homes because of the fact I've been inundated with a lot of phone calls, which makes me very happy because it shows people are really reading the Pioneer newsletter. Because on the back of the Pioneer newsletter, I don't know if I could find my copy of it somewhere in my stack of papers here, there was a little article on the Vial of Life. And the Vial of Life we've talked about a bunch of times. We gave it out at our advisory too. And it's a little sheet that has important information. And you put it, and it comes with a Ziploc bag that has a little decal on it that says Vial of Life. And then you get another decal that you put on your door. So if someone comes, Otto has his Vial of Life.
There you go.
It's like show and tell over here. And, so if someone comes in, in an emergency situation, they know that you have the Vial of Life. All the important information is on your refrigerator in that. So we've updated those packets, and we put a little article in the Pioneer if you were interested. I've been getting so many phone calls about people who are interested in that, and also a copy of the Circle of Support booklet.
All right, yeah.
So I have like a mail room system going at my desk. I have all these, Vial of Lives and just sitting here, Paul has been sending me, more calls that have come in for it. So it's really great that people are connecting, getting the Pioneer.
Curious, did you get any requests for the digital version?
I have not. Only hard copies. Yep,
Okay.
only hard copies.
Yeah, I'm surprised. But maybe people, the fact that to me, I'm going to fill mine out, frankly. But the fact that it can be digital, to me, is a big deal, because a hard copy is a hard copy, and you have to make copies or give it to people or whatever. The digital one, you can send to, if you got 3 children, send it to the 3 children. You got an aunt and wherever, send it to them, after you complete it. So I think there's a lot to be said for having that in a digital format.
No, wait, do they have to request it, or can people just download it?
Well, it depends. So for the Circle of Support, if you want, it's on our website, so you're able to download the film.
It is on the website. And
you don't have to actually request.
But you could also, if you want to call and give me your email address, if you're not sure with the website, obviously I will send it to you. It's always in our email newsletter too. So if you're on our email newsletter list, you could download, the link right on there too. So, I think too, some people just like a hard copy. Listen, if it was me, I'd have the hard copy and the digital. I'm like the queen of both options, so I'd write it all in and then type it into, the digital format too. But it's really great that people are reading the Pioneer and getting all that information, because it was jam-packed with a lot of wonderful articles. So, and if you're not getting the Pioneer, please call 311 or 516-869-6311. And I will make sure you are on the list or add you to the list. Otto's got his Pioneer.
That's what it looks like.
Which makes me very happy. And there's just great stuff in there. And it's stuff that you could really hold on to, that's not necessarily time sensitive. It's a lot of good tips and tricks. So definitely, if you did not get it, call and we'll make sure you get it.
Christina, kudos to you. That newsletter is really awesome. And Otto's Corner, and we're always looking for ideas too. If you have an idea for a project in the newsletter, for a health chat, anybody that is really has a good idea. I mean, we all come up with ideas too. It just kind of hits you,
Yeah, and I also find, doing this show and having so many wonderful guests and topics, and our wheels are always turning as we're talking to these guests. And they have such wealth of information. So it's so great to kind of have that connected. And then I'm like, let's do an article for the Pioneer, So it's, and for example, we always say on this show that it's really, especially during COVID, because of the Zoom format, and being able to be on North Hempstead TV, which you might be watching us on, while you're saying this, is that it really opened it up to not just seniors. Yes, we're Project Independence, we're a senior-based program. But, through the years, especially even in our own program itself and all the services, it's really expanded to, all ages and caregivers and people who are in the field, you know, and I found that because the calls that I've received from people who are at home watching North Hempstead TV, you know, during this, you know, COVID time where we've been launched the radio on TV, was really a lot. It's never a senior who's calling me, which I think is so interesting because you always assume like, oh, it's the senior who's watching it, but you know, no, it's been like, I'd say half of the time, the child who is at home. And I had a long talk with a woman about, you know, her parents don't even live in North Hempstead, you know, but she lives in North Hempstead. And we were just talking about services, and she was very interested in Ron Fatula's interview. And she missed part of it, so she wanted it. So I was able to send her the YouTube link, which is such a wonderful format. And I have to give a big thanks to Dan Cox, our director, for always putting it up on the WCWP YouTube page, because that is the easiest way for me to send out, you know, these great interviews. So it was just like a wonderful talk. I was on the phone with her for like, you know, quite some time just talking about it and all the topics. And she was addressing, you know, the two-family house situation that we were discussing with him and the bill for that. And, you know, she had a lot of her situation. She was saying that she, you know, and she could see both sides. It was a very interesting conversation. It was so nice to be able to give her that information. And
that was after the Ron Fatula?
Yeah, I just spoke to her yesterday because she was just watching it on North Hempstead TV. She had called me. I called 311 and then it came to me. So it was just great to do that. And it was just, you know, I was like, you know, it really is a community show. You know, it's just nice to firsthand, you know, hear about how.
You remember Ruth, who worked at the New Hyde Park Library? She and she was at this meeting.
Yes,
she came over to me and said
me too.
She really enjoyed the show, which felt good. You know, at least
it's wonderful, and I think that's what's so great. You know, about our collaboration with North Hempstead TV. You know, with the exercise classes and the radio show. You know, those are two things that I cannot say enough. I think was like a blessing of the COVID pandemic, you know, if there could be one, you know, and having that, it really connects. And people are so fearful that it's going to go away, because that's another thing. There's so many calls, Beck, I know you get them. You know, please tell me exercise classes are staying on North Hempstead TV. The radio show is staying on North Hempstead TV. And I said, yes, don't worry. We are still keeping that going, and it's just it's wonderful. I think it opens it up to people who might not have known about, you know, these programs,
who really maybe don't have a computer, and don't really get out, but now they're finding on television they can do these programs. I mean, we even had a question about it at the advisory, like, you have to get the word out, you have to, you know, but which we do, you know. So yeah, it's great. But I always think about, you know, these incredible things at Project Independence that we do, you know, the newsletter, this radio show, Circle of Support. I mean, all of these were initiatives that started at an advisory from a senior town resident. Every single program, I mean, and the most successful ones, I mean, some are kind of replicated programs and things that we do, but these programs that are they just don't go away, and they kind of get a whole world of their own. I mean, Circle of Support that started out at the Great Neck Advisory came out of just, which I think is our oldest community. Great Neck. So, you know, we had a lot of seniors when we met in person, fully in person prior to COVID, and even years before that, when Edith was the social worker for that region. And there was just this every month, Christina, you know, people just saying they need advocacy when they go to the doctor. And these were people that were more open to help. And then we kind of talked about it and worked with Edith and the social workers, and, you know, this whole Circle of Support booklet came about, you know, and it just kind of evolved.
Because it was so much, Beck. I remember sitting there, because this was, you know, years upon years ago, and it was just like, who do I call? You know, that's what question would just constantly come up to us, because, you know, Beck and I were always there every week, you know, every month together. And it was, you know, so that's what was so important, to have this tool that you could look at and say, okay, you know, here, this is who I call in this situation. Or, you know, and you kind of found out where your gaps were.
Right.
And I think, you're so right about the advisory committee piece of it, and just having that collaboration, because that was always the piece of, the PI kind of trifecta of things, And,
See, I had a little bit of a problem with those questions, all right? In that, first of all, Project Independence makes every effort to get the word out for things.
Mhm.
And sometimes you, on the other end of it, me, meaning not the people from Project Independence, but have to kind of look around a little bit and reach out and find out what is available and what is going on. Not everybody is going to get a personal phone call or an email or whatever. So I'm just saying, I'm encouraging people to try to reach out a little bit on your end.
And we always say too, it's the importance of people who do know about Project Independence to spread the word to, their community members or their neighbor or their friend or someone they go to the church with. So we have so many people that have been part of Project Independence, like yourself, Otto, since, the beginning, that are, have been and know these programs and can really spread the word. And I think, we laugh all the time because there's so many people that, will take an exercise class and are just saying, like, thinking it's an exercise class.
Right.
They're not thinking that it's like Project Independence is the header, because it's unbelievable. And I can understand why people don't know, because Project Independence is this giant umbrella that has all these different services underneath that people aren't necessarily realizing goes back to Project Independence.
Right. I feel like it's more important to us that people utilize the service than say, okay, I'm a Project Independence member. Listen, if you're using the taxi service, you're a Project Independence member. If you're 60 and over and live in North Hempstead, you're a Project Independence member. If you register, then you just probably get a little bit more information. You have a little bit more of a connection. But there's so many services and programs that we do, like the taxi program. Maybe they don't consider themselves a Project Independence member. Maybe they just don't connect to it. Even though you have to say, I'm with Project Independence to get a ride. The exercise classes, they come once a week. We're back live in person too. And a lot of people don't really understand. And it's important for people to know about Project Independence and all the services. But, and like there are people that, how come I never heard of this program? Meanwhile, they got their vaccines, they're part of one of their reoccurring support groups. They use transportation and they take an exercise class. So what's more important to us is that they're utilizing these services and it's helping them age in place, and I mean, it is also important that they know that Project Independence exists for them. But, it's kind of just the way that it is,
Exactly.
Well, what was also very good at the advisory meeting was Kelly and Krista, Kelly Steinman and Krista Papadora.
Papa Theodora,
a social worker. Both gave a little bit of a presentation, and they both did a very, very good job. And all the social workers and nurses were at the meeting, so people could have chatted with them if they wanted. All good people, all caring people. And I think it was good that they were all there, because it's been a while.
I just want to tell people that what they announced also is, for a while now, obviously you could visit them in their offices, but now they are officially, able to do home visits. So if you are in need of a home visit, please call 311 or 516-869-6311, because that is something, that was such a miss. I mean, the calls back, that we were getting from people saying, when are home visits going to resume? And it's just so great that they got clearance to do that. And to really, because it's so important, if someone's obviously wants to have a home visit, where no one's forcing home visits on you, but if that's something you want, it's just a different level of connection, to be in your home with the social worker or nurse. And a lot of times the social worker and nurse will come together, and do that because they each have their skill set. So I think it's
well, a good question is, why would you want a home visit, and what could you gain from a home visit? My opinion is you want a home visit if you have a situation where caregiving is required of some kind or another, Or maybe you're thinking about planning for that stage and you want to talk to people who that's what they do. They're out helping people who are planning for future years when you get older. Maybe they want to learn a little bit about Medicaid and what they
well,
can do.
that's what, a lot
My
of it
point
is.
being, though, that they are all encompassing. They know a lot about a lot, and they can guide you.
Right.
Absolutely. And, it's filling out documentation, right? So there's certain entitlements or, benefits, they had mentioned, food stamps, just as an example. So these are things that, involve filling out documents. So that's it's really easier, and that they were trying to make do during COVID when they couldn't, doing things virtually or on the phone, and it's just not quite the same, so now that they're able to sit, fill out the paperwork, fill out any kind of application for all different things. And it's just, it's a more personal thing. And listen, it's also nice to have that personal socialization component, with someone at its core, regardless of what you're talking, you don't even need, and that's what I want people to know. You don't necessarily need to have some heavy issues for a social worker or a nurse to come visit you. You could just be like, I just want to meet and discuss my options, programs, and this is also goes to the caregiver out there, the adult child who, might live in North Hempstead that is caring for their parents that wants to understand a sense of this. So, it's a really broad area that, you are able to do. And simply, and so you can do a phone call if you are more comfortable. You can come to the office and visit your social worker or nurse. And now, home visits are back. So it's having, as I said, options are the key to, we can't make everyone happy, but we try to have as many options as possible to really get connected.
I'm sorry, but you could be a parent, not a parent, but a child or family member who lives out of town, who can communicate with the nurses and the social workers on the phone, via Zoom.
Yeah, and let me tell you, that was something that really ramped up.
They can be your link to what's going on with your parents.
Absolutely.
And we have a Project Independence member who's been with us since day one, and she's turning 99. So
wow.
Not only is she getting her nurse to visit her again in the check-ins that they've been doing via Zoom and phone calls over, but they have an established relationship over the years. I mean, the wonderful thing about our nurses and social workers is it seems like once we get them, they're with us. I mean, they're with us forever. And, we've been lucky enough to have these wonderful professionals that, go to someone's home and are consistent, and they can be, counted on. And the residents understand that there are limits to what kind of the social workers and nurses can do. It's not like they're going in and they're doing vaccinations, and they're going in and they're offering, very kind of specialized advice and services, and can talk to family members and can talk to doctors and assist with medication management.
So it's just so huge. And that's, and that's something that I think is so interesting, and an issue we knew would be coming, with things opening up, and God willing, we continue on this path, of things being, returning to, a normal kind of playing field. So many people, the nurse that addressed at the advisory have, neglected going to doctors because of fear of certain things. And there's so many, everyone was so hyper-focused on protecting yourself from COVID that they were, and listen, I can speak from experience too. I mean, how many of us let a lot of follow-up things fall by the wayside because you were just really just your main thing was let me not get COVID and, survive this whole thing, so it's a lot of kind of getting people back to their routine, checkups and different doctors they need to see, and just kind of getting, life back to, a routine, as I said.
Well, I think that's one of the big things about Project Independence. It's a government, if you will, run support system. All right. However, it is not like a lot of government support systems. There is not a lot of churn. There's a lot of very established relationships. There's a continuity that goes on, which to me is very important, because there's a constant, people who've been involved with this like me for a long time.
Yeah.
There's a consistency here that doesn't exist in a lot of things. And
it's so true.
I like to use the word churn. You know, I've been in a lot of churn situations in corporations. And when there's churn, everybody's just worried about their own job, or, you know, nobody's really worried about what the goal of the whole thing is. There's no churn here. You know,
I like that word, Otto. I like the way that Otto says that word too.
Well, believe me, I've lived through churn many times, all right? And churn is a very bad thing. You know, I've been in big corporations, and when there's churn, all the thing people worry about is their job. There's nobody worrying about the goal of the company, the customers, nothing, you know, and it's a bad thing. So my point being, that doesn't exist within Project Independence. So that's a good thing.
Absolutely.
You know, we're going to take a quick break. You're listening to Project Independence at Talk of the Town with Otto Lohse and Christina Liu on 88.1 FM and WCWC.org.